there's a better way to fight the opioid crisis. Why aren't we focusing on it? Dr. Hurd, can pot be a solution to our opioid epidemic?
Yes and no. It's not pot that's the solution, it's medical cannabinoids. So I think that unfortunately the lines have become blurred in wanting to have recreational use of marijuana, that people have, legalized medical marijuana. And when we say medical marijuana, a lot of people, including perhaps Governor Christie and the president, thinks that it's the marijuana on the street. It's not. These are cannabinoids that are being tested in research and clinical studies that have, for example, no intoxicating effects. The cannabinoid, the marijuana plant has over 100 cannabinoids, and it's not just THC, which is the cannabinoid that produces the high, the reward. It's other cannabinoids that are being studied in regard to potential beneficial effects for pain, for even treating the opioid addiction itself and other symptoms.
He says we lack sufficient outcome data. Is he right in that regard?
Absolutely, I completely agree, and that's the whole issue. For an epidemic, we need more information. We need everybody at the table. We need much more dedication and resources to coming up with alternative strategies, and for that you need data. There's currently not enough data, but there are some anecdotal evidence out there, and anecdotal is not proof, and so we need causal studies to be done. And so yes, there's not enough information to completely give 100% results to say this is exactly what the specific cannabinoid can treat this specific pain or this specific symptom, but that's exactly why we need much more research and the support by the president and the governor to conduct those kinds of studies.
Dr. Hurd, Governor Christie said something else about cannabis users on television. I want you to watch it and then react. Play the tape.
The National Institutes of Health, no partisan organization, just came out with a report that said you're 2.5 times more likely to be an opiate addict if you smoke marijuana.
Is he blurring the line between recreational and medicinal use?
Again, yes, absolutely. So, I mean, even our studies, if you even take animals and give them THC, they show greater sensitivity to opioids in terms of their reward sensitivity. But if you give them cannabidiol, CBD, the cannabinoid that is used for treating kids with epilepsy, for example, they show a reduction in their opioid intake. And that's the cannabinoid CBD that we're brought to clinical trial and shown that indeed in human heroin abusers, cannabidiol does seem to decrease heroin craving, the anxiety associated with addiction. So it is a blurring of the lines. We should stop perhaps talking about marijuana and say medical cannabinoids, so that we are clear that this is not the marijuana on the streets. The marijuana on the street has today a concentration even 20%, and people are making cannabinoid formulations for recreational use that even go up to 80% THC. That is not the cannabinoids that are being used in the clinic. That's the thing that I think that both the person on the street needs to know and the government needs to know. We are talking about developing specific cannabinoid as pharmaceutical interventions. It's no different from any other medicines that are being developed. You have to know the dosing, you have to know the formulations that may be best for treating that particular symptom. And without the research, we will not move further. And there are a lot of regulations that unfortunately prevent research being done.
Dr. Yasmin Hurd, we really appreciate your expertise on an important subject. Thank you.
Thank you.
Still to come.